Okay, welcome everybody to WorkSafe's training today. We're going to be talking about legal advocacy for safety and health. Thank you so much for joining us. My name is Jora Trang. I am the Chief of Staff and Equity at WorkSafe. My pronouns are they, them, theirs. This meeting is being recorded. We want to make sure that we are meeting accessibility needs, and so want to make sure that you are muted during this session. If you need closed captioning, please make sure to click closed captioning. It's a little button at the bottom. This is our main room. We'll have a couple of breakout rooms. The closed captioning will continue in the main room with an ongoing lecture for those of you who tune into this recording later. Just some things to keep in mind. Please make sure that you go slow and speak clearly so that the live captioner can capture what you're saying. You'll notice that the speakers here will all be having an even pace. Put your questions, if you have any, in the chat functions, and we'll make sure to try to get to those if possible. If there are people who don't want to go into breakout rooms, you are welcome to stay here in the main room. Just chat so that we'll know. At the end, there will be a survey. For those of you who want MCLE credit, make sure you take that. But we want all of your feedback. So everyone, please, I encourage you to take that. So this is our second training out of 7. Today, this is part 1 of legal advocacy. Part 2 will be next week. Please make sure to register and join us for all of our trainings. Our trainers today will be Nicole Marquez Baker, she, her pronouns. She's the Director of Policy and Legal Services. Joining her will be our staff attorney, Karine Umphrey, who is the amazing coordinator of this series. Her pronouns are she, her. So WorkSafe is a nonprofit organization that is dedicated to preventing worker illness, injury, and death by bringing justice to the workplace. We are the California statewide expert on occupational health and safety, and we're so happy to be able to share our knowledge with you today. If you go on our website, you'll be able to find different resources such as our trainings, policy advocacy that we're engaging in right now, movement building, and legal support. So please feel free to visit our website at worksafe.org. You can also join us on Facebook and Twitter. So I'm going to hand this over to our first presenter.
Good afternoon, everybody. I wanted to see who we have here today. I'm going to launch a poll. It is now in progress. If you could select an option of what represents you, that would be great. I will give a couple more seconds as votes are coming in. Okay, I will end the poll now. This is great. It looks like we have a lot of worker advocates here today, also some attorneys with experience and a few law students or graduates or interns. We also wanted to know what you have the most experience in related to topics we will discuss today. Feel free to choose more than one option. I have now launched the poll. I will give a few more seconds as the votes continue to come in. Thank you for answering our poll. And thank you for sharing. There are a lot of you with organizing and worker advocacy experience, employment law experience, and great that a lot of people are here to learn today. So the goals today will be to provide tools to conduct client intake on worker health and safety and COVID-19 related issues, and to provide a basic overview of a couple relevant occupational health and safety standards. We will also engage in an interactive activity, applying tools and other information to a case study. Next. So this is a agenda or roadmap of how this presentation will go today. Next, please. We would like to do a refresher of the case study that Training 1 covered and that I emailed last night and both this morning. In this case study, Maria is Filipinx, pronouns they, them, and is a nurse at Boba Hospital. They are not given N95 masks, but other doctors or clinicians have N95 masks when interacting with the same patients. Boba Hospital is using a new disinfectant that smells strange and irritates Maria's eyes. Maria's supervisor makes comments about their ethnicity and calls Maria her. When Maria goes to the grocery store, Steve, he, him, is cashing them out. During his shift, there are always people coming in, making it difficult for him to find time to wash his hands. He feels pressured to stay and keep the lines moving. Steve does not have access to gloves and masks except once a day. The store does not have plexiglass shields. As Steve checks Maria out, they see a person screaming at Kate, she, her, the worker who monitors the number of people entering the store. Kate asked the customer to wear a mask before entering, but he said it is his choice and threatened her, making a complaint about her accent and demanding to see the store manager. So at the last training, people pointed out and wrote in the chat some significant issues and areas of concern that they identified, which include that Maria is working with COVID positive patients at a hospital, which means their protections fall into the ATD standard. There's a problem with effective personal protective equipment. In Maria's story, there is an issue with the new disinfectant. They also face discriminatory and retaliatory action by the employer. Steve faces hand washing access issues. In general, are missing ineffective COVID prevention protocols and control measures. There is also no mention about training on these measures. Kate is exposed to workplace violence. And there is also inadequate supervisor support on safety. Nicole?
Hi, good afternoon. So great to see so many of you joining us today. I'm going to cover, just do a recap briefly on some of the key issues that we talked about last week in with respect to the categories of workplace hazards. We'll also be covering some tools for you all to kind of consider when conducting worker intakes and really from a worker-informed perspective. And then you'll be engaging with this case study that Cutting just went over, kind of using some of those tools. So the first part is the recap from last week. You'll see we have these 6 categories of workplace hazards. First one is physical, which has to do with kind of the environment that workers are in, temperature, radiation. Chemical category really has to do with gases, dust, fumes, mist, vapors, kind of in this bucket. Infectious and biological category has to do with blood-borne diseases, bacteria, viruses, and so forth. Ergonomic design category really has to do with forceful motion, repetition, and posture. The category of safety hazards has to do with kind of mechanical hazards, slip, trips, and falls. And the last one is workplace organizational hazard, which really impacts all of these other categories. It has to do with workplace stressors. Next. This next part is the, the bullseye that we covered in the last training. And I really want to emphasize kind of the importance of this type of, these types of controls. So personal protective equipment you'll see is on the outside of the bullseye. And so this is really the least effective type of control. It is really something that is, that really kind of puts the burden of change on the worker. And what we would like to push for is having that burden of change be on the employer. They are the ones that have control of restructuring and eliminating the hazard. So really the most effective is in this bullseye in the middle, right? Next, please. So identifying hazards and injuries, so we'll just share with you a couple of different tools that we use in our trainings, and also they're very helpful tools for folks to use when they are conducting worker-informed intakes. So the first tool is a what is called a body mapping activity. Mapping is useful because it really recognizes safety and health hazards. You don't have to have a certain level of literacy, and so it kind of respects the context of workers where they're at, and really allows for workers to be able to identify, hey, my coworker is also experiencing the same type of hazard or same type of pain or stress in their body. And then workers are able to come up with their own solutions, really, again, taking ownership of what those solutions look like. Next, please. So this is what a body map would look like, what we would ask workers to do, or folks that we're collaborating with, is to identify kind of on this body map what is causing their, where the pain or the stress is showing up on their body, right? You have different types of things that manifest in folks' body because of stress or pain. And so you'll be able to identify patterns related to workplace diseases or injuries amongst groups, and really get the ability for workers to have a conversation about their bodies and about how that stress or that pain is manifesting in their body, and kind of make those connections with kind of in a collective way. Next slide, please. So again, we would have somebody kind of role play in their where is it hurting in their body, and where is the stress appearing in their body. And then folks would take stickers and identify on the body. We understand that folks are we're in a different context now, with working with remotely, or doing a lot of work virtually. So this could also be adapted, and we can share with you how we would adapt this type of activity for folks who are interested in learning more about how to do so. Next slide, please. So once we've determined kind of where on the body the pain or the stress is appearing, what we then have folks go through an activity which is connecting that stress and pain that's appearing in their bodies, connecting it to a hazard map. And the hazard map is a really great visual representation of the workplace, again, allowing for workers to really take ownership of where designing their workplace, right, and showing you where exactly there are physical hazards, chemical hazards, stressors, and then connecting that to how that is impacting folks' the pain or the stress that they're experiencing in their bodies. And it's really a helpful tool to be able to identify kind of patterns, and like where you're seeing kind of more frequent injuries or more frequent exposures, right, for with respect to COVID-19. Next slide. And again, we're happy to talk with you all about kind of more in-depth training on either of these tools, so that you're able to kind of incorporate them into your intake process, or your other kind of advocacy process that you all are engaged in. Next slide. So we're now going to have you break into a breakout group for 5 minutes. What we would like to have you all do is identify hazards in the case study using the color-coded categories. An example would be Maria said that their eyes get irritated with new disinfectants. This category of hazard would be in that bucket of chemical. How would these hazards impact physical and mental health? We're really looking at you being able to identify kind of from that body map how those, how the hazards would impact their physical and mental health. And then identify also specific work locations from the case study and related to the hazard. So identifying kind of where you're seeing the hazard of chemicals appear, or the category of hazards that relate to biological diseases and exposure, identifying that in the workplace and have a conversation about that. And then really the objective of this case study and breakout group is for you to learn about worker-led and worker-informed tools to formulate questions that can really be teased, that sometimes are difficult to tease out in a traditional client intake. And so I believe that Karine has set you all up for breakout sessions, and that will be for 5 minutes. And then we'll return once we're done with that breakout session. Thank you.
Thank you, Nicole. So while Nicole and Karine are doing that, I'm going to continue lecturing in the main room. We had a participant chat into that. A really good thing to remember is that you want to ask folks when you're doing intake for anything that ever bothered them or ever hurt them ever. So not restricting it to time so that you can get a full picture of how their injuries may have evolved. A lot of injuries sometimes are chronic, and so they show up over time as opposed to immediately. So I'm going to continue lecturing while you all go into the breakout room. Looks like you're not all there yet, but I'm just going to continue. So let's say that you have met with Maria, Steve, and Kate, and you have engaged them in a body mapping exercise. And in the process of doing this, you have learned that what we often do is we have different colored stickers. The red here that you see often indicates some kind of physical pain, whereas the green stickers indicate some kind of mental or physical stress. I mean, mental or emotional stress. So this is a great way to kind of deciphering exactly what is going on and being able to trace the root cause. And let's say that you've also had Maria, Steve, and Kate draw out a workplace map of the workplace. Maria would be drawing out the health clinic or facility, whereas Steve and Kate would be drawing out the grocery store. So once again, just a reminder of the 6 different hazard categories. One thing that's really important to remember about this is the way this looks like a Venn diagram, because it exactly is a Venn diagram. All of the different hazards correlate to each other. So if you are, and work organization and psychosocial stressors such as the fear of retaliation, how fast work is growing, in our case, in the pandemic era, how maybe folks aren't social distancing enough, not wearing masks, the fear of getting exposed to biological infectious diseases, all that kind of fear sits at the root of all the other hazards and makes it worse for the possibility of these other stressors, these other hazards also affecting workers. So I don't want to give the answers away because not everyone, has everyone gone into their groups yet? Karine, give me a thumbs up. Yes, okay, everyone's gone in the group. All right, I can continue. So here we are. The purpose of this exercise was to have folks go through the case study and take a look at what Maria, Steve, and Kate are experiencing, and then to try to figure out how these relate to the different hazards. So Maria experiences a screening process or temperature check at the front of the hospital. There can be a couple of hazards that might occur as a result of that. One of which might be the exposure to infectious or biological disease, in this case, the coronavirus, because assuming that this screening process actually can identify folks that might be carrying coronavirus. There can be a concern with standing too close, not social distancing enough at the front of the hospital. Also want to note that coronavirus is asymptomatic. So just because you have gone through the screening process doesn't eliminate the process of being affected, possibly infected. The boss keeps using incorrect pronouns. This can result in organizational psychological stress to Maria. Patients not masked in the reception, also infectious biological, COVID possible positive patients. Maria was asked to use an unidentified disinfectant that may be exposure to a chemical hazard of toxic chemical that she doesn't understand. They don't understand what it is. There was also Asian targeting for the spread of COVID-19 that relates to work organizational psychological stressors related to race equity issues. Steve and Kate experienced hostile patrons refusing to wear masks. So there's a two-pronged thing here going on. You might have infectious hazard. You also have a workplace violence hazard potentially and a stressor. COVID prevention protocols and control measures and PPE and disinfectants running out are also issues with, again, infectious biological hazard. I'm going to add a couple of things in here just to take a use of some of this other stuff. Let's say that Steve and Kate are working in the grocery store. It's super hot. That is might be a sign of physical hazard because of indoor heat. Let's say there's not enough ventilation or air conditioning. Let's say that Steve is sitting down all day long at the cash register. I mean, most cash register folks stand, but let's say he's sitting down all day. That could result in an ergonomic issue if it's causing issues with just the way his body is situated at as he's sitting. Some safety issues and physical issues as well might be, let's say Steve goes in the back room of the grocery store and there's no rubber mats on the floor, but it gets wet a lot in the back of the grocery store. So there's a slip fall hazard. So that may bring into account safety issues. All right, I think people are returning now. All right.
Okay, thanks everyone for participating in that breakout activity. Really hope that you were able to have some good conversations about the categories of hazards and how body mapping and hazard mapping can be used as tools to conduct more worker-informed and worker-centered intakes. I'll now pass it over to Karine, who will discuss some of the regulatory framework, OSHA regulatory framework in this context that we're in currently. Karine?
Thank you. So CalOSHA is the California state program responsible for protecting the health and safety of workers. CalOSHA makes sure that employers follow occupational safety and health regulations and keep the workplace safe. Almost all workers in California are protected by CalOSHA regulations, often called standards. This includes public employees and immigrant workers who are not legally authorized to work in California. However, there are some workers who are not covered. These include people who are self-employed, independent contractors, domestic workers and day laborers, family members of farm owners who work on the family farm. Next slide, please. In yellow are the standards that we will cover today. We will cover the ATD standard at a different training in the future, and a couple of these other standards at the next week. Next slide, please. Because COVID-19 is a recognized hazard, we think this regulation will be an important standard. With this standard, employers in California are required to establish and maintain an effective injury and illness prevention program, IIPP, The program must accommodate non-English speakers and covers both temporary and permanent employees. COVID-19 is a recognized hazard, particularly in some work settings, as you know, healthcare, but it still applies to other work settings that we've seen with essential businesses, includes janitorial staff who work in those like a bank or a grocery store. Employers would have to comply with these steps after recognizing COVID-19 as a hazard. These are that the employer takes accountability and that at least one person is appointed as the go-to or person responsible for the hazard of COVID-19. The system should ensure that all employees, including supervisors and managers, comply with safe and healthy work practices that are designed to make the workplace more secure. Arguably, a social distancing in the workplace requirement would be a work practice designed to make the workplace more safe than not, so the employer would incorporate this as a practice. There needs to be a system for communicating with employees about issues involving COVID-19, such as policies and procedures that must be followed, and incidents of exposure to COVID-19. Employees need to be able to report and discuss issues without being retaliated against for speaking up. Employers must have procedures to identify COVID-19 hazards and exposure risks. Employers must have procedures for investigating worker injury and illness arising from COVID-19 exposure. Employers must also have procedures to fix unsafe conditions and to reduce the exposure of COVID-19, such as barriers and or shields, reduce the amount of workers in a particular space, allow additional time to wash hands and gloves or masks. Also to ensure this is done in a way so that workers are not retaliated against for reporting COVID-19 health and safety issues. Employers must also give training and instruction in a language that the workers understand. So that could mean that if there are workers who are monolingual Spanish speakers, the employers must give training and instruction in Spanish as well. Finally, the employer needs to keep records through the log 300. And as of July 1st, 2020, workers may request a copy of the IIPP from the employer. This originally was not the case. Next slide, please. Another standard to cover is sanitation washing facilities. Every place of employment must have washing facilities for personal cleanliness that is accessible to all employees, maintained in good working order and in a sanitary condition. The laboratories must have running water that has available water at temperatures of at least 86 degrees Fahrenheit in particular situations and have suitable cleansing agents. Each laboratory must also have clean individual hand towels of cloth or paper or warm air blowers. There's also washing facilities construction in section 1527A, where employers are required to provide washing facilities for workers. They must have a minimum of 1 washing station for each 20 employees that must be maintained in a clean and sanitary condition, along with the other requirements above, such as readily available supply of soap and readily available supply of single-use towels and warm air blower. Additionally, for the field sanitation, agriculture employers must also provide hand washing facilities that again have suitable cleansing agents and single-use towels, potable water, and a single-user toilet facility that meets the applicable standards in the regulation. Next. We will also cover the hazard communication standard. This is the right to know about chemicals. So workers have a right to information about chemicals and other hazardous substances you may be exposed to at work. This requires employers to provide labels, safety data sheets, and training. We think this will be very important in COVID-19 with new disinfecting and sanitizing protocols. And we have some time, so I want to look at the questions in the chat, which I encourage all panelists to answer. So I see a question about, what about Mixteco, indigenous language from Oaxaca, Mexico? I think that is related to the IIPP, if the employer is required to provide training in that language. Nicole, can I invite you to answer that?
Sure, and you know, this is something that I feel like would probably need a little more facts to understand what the you know, what the majority of the workplace looks like. And so to the extent that the majority of the folks are Mixteco speaking, it would be something that would likely be you know, required from the employer to ensure that their IIPP training is effective. It needs to be in the training. It needs to be in the language that most folks understand.
We also got an answer from somebody that did say something similar, that's a tough one. Check out Radio Jornalera. They do PSAs and interviews in Mixteco for farm workers. Someone asked, what is required per 20 employees? So this was back on the sanitation and washing facilities. I believe that I said in the washing facilities construction standard, that is California Code of Regulations, Title 8, Section 1527A, that employers are required to provide washing facilities for workers. They must have a minimum of 1 washing station for each 20 employees. All slides from the trainings will be made available, and the recordings will be made available at the end of the series of the trainings. And are there any more questions on these standards that we just covered? So somebody asks, can you speak to the differences between California hospitals' adherence to CDC guidelines versus CalOSHA standards? Not sure what that word is. Use of PPE by healthcare workers. So Jora, correct me if I'm wrong, but there will be a standard, there will be a training a couple weeks from now covering hospitals and ATD standards and those sorts of nuances.
Yeah, we will focus it on this in a future training. So at least for your knowledge, CalOSHA has certain standards that Karine has gone through that they're able to cite on with respect to guidelines and guidances. They cannot cite on that, which is one of the difficulties of where we are currently with enforcement with CalOSHA.
Yeah, and then I would just add, per the governor's executive order, there's really this emphasis on compliance and guidance and enforcement around serious citations. And so there's been, there's definitely some frustration around that with respect to enforcement of the standards that Karine had just highlighted.
Okay, I think in terms of the case study, somebody noted that there was no sound in the breakout group, so we just need to make sure we, I don't know, unmute people or something.
Yeah, so if somebody could write in the chat that if it was like a mute issue, or did you mean you could not hear Jora presenting the lecture on the main session? Because if so, we could answer why that is. I was not clear if the problem was you couldn't hear each other in the breakout session, or you were looking to hear Jora's presentation. I don't see anybody wrote back yet. I do see here that, oh wait, here we go.
We could hear each other. Okay.
Oh, okay,
Okay.
that's because I'm in the main room and you won't be able to see me while you're in breakout. I'm sorry.
Right, Jora, could you just explain why you are doing that?
Sure. So the reason why I'm doing that is because we are providing this for later, and other folks who either couldn't make it this time or have accessibility issues will be able to tune in and watch and listen to the recording and or read the closed captioning for later. So we didn't want a blank session, which is just a slide with nothing going on. So if you are interested in hearing the lecture, which just basically lays out what you were talking about in your case study breakout, tune back into the recording to do that.
Okay, go ahead, Nicole, to present the next case study.
Yeah, so in this case study, we'll have you'll have a breakout group for 10 minutes. You will, in your group, designate someone to do a report back. We're hoping to have some time to have some folks who are able to give a report back on what they learned from this breakout group. You'll read the case study number 2, which is Carla. And the questions that we're asking you to focus on are, what kind of questions would you ask the worker to help you understand the workplace? So envision that Carla has come to you or your worker center or your legal aid organization, and you want to be able to have some kind of very specific questions, or maybe glean from the worker informed tools that you would use to help understand Carla's situation. And then we also would like you to apply the law. We know that there are many other laws that might be involved in this fact pattern. What we'd like you to really focus in on the ones that Karin had covered around sanitation, HAZCOM, and the IIPP. And so you'll have 10 minutes to do that. I will quickly go over kind of some of the facts from Carla's case. Carla works as a nursing aide at Golden Gate Assisted Living Facility, GG, with 120 elderly residents. Residents and employees are social distancing at GG, non-communal activities. Carla buses to work and wears a cloth mask on the bus. She gets screened when she gets to GG and has to declare that she doesn't have COVID-19. GG is short-staffed and everyone used up all their sick time after the stay-home order. People don't want to take sick days without pay. Carla wants to demand that N95 masks be provided because she thinks they are better, but she's afraid. GG has increased sanitation in common areas, but not in residents' apartments. Carla has come into physical contact with residents when caring for them. So now we'll have you all go to your breakout rooms. I hope that's ready, and we'll see you when you return.
All right, and as people are going into their breakout rooms, I will continue in the main room. So stay with me for those of you who are staying or tuning in later. So let's imagine that Carla has come to your legal aid for help. You have gone through the body mapping and hazard mapping. Carla has identified maybe on her body where she's feeling issues. I imagine that Carla might be feeling a lot of stress as a result of this whole situation, the stress of perhaps running out of sick leave and not being able to take sick time, of caring for patients that she has to come into physical contact without enough or sufficient sanitation. So she might be having a lot of stress that might show up in terms of headaches, maybe there's some stomach queasiness going on, wherever stress shows up for people. And let's say that you've also done a hazard map, and Carla has drawn out for you this amazing picture of the workplace, the residential. Maybe she's just focused on one particular floor, the floor that she has to work on, and the various residential places, apartments that she's entering. And let's say on the hazard map, she has drawn residential apartments and noted where the restroom and washing facility is for her, but it is at the very end of the hallway. And in order to access it, she has to leave the apartment, go to the through the hallway, which is about a 5-minute walk, and then use the facility and then go back to what she does. You'll remember from the fact pattern that Carla has additional duties now, not just what she originally had to do, but because of the social distancing, not allowing family members to do what they used to do, she has taken on all these extra duties in addition to duties or responsibilities put upon her by the facility manager to wash her hands, to social distance when possible, to engage in sanitation and disinfecting activities, all of which occur mostly outside of the apartment. So we want to ask you to think about what kind of questions would you like to ask Carla if she's your client, she's sitting in front of you, to figure out what different, whether or not the employer is in compliance. So some of the questions that you might ask to figure out whether or not the IPP or the Injury and Illness Prevention Program is in place at the workplace is, let's just pretend you're Carla and I'm asking you. So Carla, so if you get sick or if you get hurt, who do you report to? Do you know who that person is? This calls into question the IPP requirement for one individual, or a clear idea of who that individual is. Carla, do you know if there's a safety plan of some sort? Like, what are people supposed to do now that there's this fear of COVID-19? What do they do? Do they call in ahead of time if they have illness? Do they just show up and go through screening? What goes on? What's the safety plan? And then if they do get sick, or they think a coworker is sick, or they think a resident is getting sick, what are they supposed to do about it? So that calls into question the reporting and identifying or flagging hazards for the employer. So Carla, have you ever seen the safety plan, or have you ever seen the IPP? I mean, most people don't use IPP, but the safety plan or the rules or protocols or anything written about what you're supposed to do now? Can you read English? Do you read another language? Let's say you read, you're able to read Spanish. Is this same safety plan in Spanish for you? So that calls into question the issue of the IPP being accessible to people. Is there a way for you to report a hazard that you notice without being afraid that you might get fired? That calls into question the ability to be able to report something without retaliation. You can also ask, so ever since the pandemic came about, did you receive any trainings from the employer at all to help you understand what you're supposed to do in this time? So all those kind of questions pull in the IPP. Now, with regard to sanitation, things that you might be able to ask are, so Carla, can you walk me through your day? What do you do on your shift? And then tell me when your breaks are and how do you take your breaks? You might also want to ask, okay, so if you have been in a residence apartment, are you allowed to use the restroom, or do you want to use the restroom, especially if you're not sure if the sanitation is the same? Does the employer engage in sanitation in the residence apartments? If not, if you need to wash your hands after working with a resident, how do you do that? And how much time do you have to do that before showing up at the next residence apartment room to assist that? how many residents do you have to take care of? Let's say Carla tells you, I have to take care of 10 residents in a 3-hour time span with only one 15-minute break. And I'm supposed to wash my hands, you know, wear a mask, wear gloves during this whole time, but my mask and my gloves I keep having to take it off, or my gloves keep getting dirty in the process. So you want to kind of tease out what happens after every single instance of that to figure out if the sanitation rules are being applied. So then you can also go deeper. So Carla, you're in the restroom. What does it look like? Tell me exactly what it looks like in the restroom. Is it clean? We've already determined that it's way too far. You know, she has to walk way too far to get it. Is there soap of any kind? Is there disinfectants of any kind? Does it run out? Is it constantly being filled? Does the water ever get cold? Does the water ever get warm or hot? Are you able to run the water for longer, for about 20 seconds? Can you say the alphabet while you run the water, or half of the alphabet? And what about after you're done? How do you dry your hands? Is there one towel, two towels? Are the towels constantly running out? Who's responsible for filling the towels up, and when do they do that? And I often see workers who are in mobile units, and that takes us a little bit out of this context, but workers who are working on cables, lines, telephone lines, internet lines, and or construction sites are often mobile. And this sanitation question is a huge problem. Where do you use the bathroom if you're in a mobile unit? If you had to enter, say you're the cable person and you had to enter a person's house in order to cable the house, and you needed to wash your hands, were you able to use their restroom? If you used the restroom, did you know whether or not they sanitized their restroom? Did you have a way to sanitize your hands or yourself after you use the restroom, the resident's restroom? If not, say the answer to all that is no, which is probably what's going on. Did you have a place to go to wash your hands while you were driving to the next appointment or the next house that you had to do to visit in order to fix the cable situation or problem? So mobile units are a particular issue, and you find these with employers of cellular services, cable networks, internet networks, and construction sites. So with respect to HAZCOM, we want to make sure that the employer is providing some way to communicate about chemical exposures and other exposures of hazards, but also that there's labels. So in this situation, I believe Carla was given a disinfectant, may have the case studies mixed up, but say she was given a disinfectant and there's no label on it. So you might want to ask questions about, okay, so when were you provided this disinfectant? Were you ever provided a disinfectant with the label on it? Were you ever provided a training? Did the training tell you specifically what was in this? Were you provided with safety data sheets? And what safety data sheets are is a kind of a complicated piece of paper that lists out different information about chemicals. It is also now supposedly able to be online for certain chemicals related to the nail salon industry. But for the most part, safety data sheets are very difficult to read often, and often difficult to find. But for the purposes of HAZCOM, you want to know, well, did you have access to the safety data sheets? Are they kept somewhere? Are they in a language in English?
Hello.
Hi, are we back now, Karim? Should I stop? No, not yet. I'll keep going. All right, so these are all different things that you can work to ask your client. So how does the law apply to this fact pattern? I'm going to go back to the fact pattern. So with respect to the IAPP, we don't know because we need to know more information. But I can see that there are several concerns here with respect to, for example, the N95 mask. Carla wants to ask for masks, but she's afraid. So that tells me that there might be some situation at her work site where she's not clear as to the actual process for identifying a hazard and then reporting it and then ensuring that you're not going to be retaliated in some way. And retaliation can look like many things, but it can look like having your hours cut short, being assigned to the graveyard shift or any shift that is not good for you and your family and your needs. Being transferred to another facility, being given roles or assignments that are not they're not the employees' favorites assignments, like they're assignments that are difficult and unpopular. So because she's afraid, I might glean from this that the IAPP is not clear, and this employer's IAPP with respect to COVID-19 is not clear. So all employers are required to have an IAPP for all the multiple different hazards that might be present in the workplace. So we're just focusing on coronavirus in this situation, but let's say that Carla works in the facility and it gets really, really hot. So indoor heat might be one of the hazards that is in that facility. The IAPP should also cover indoor heat. Let's say that there also may be some workplace violence issues or elder violence or elder abuse issues. The IAPP also needs to have a safety plan for how to address workplace violence. If there's any kind of tension in the site, how to address conflict resolution, or how to provide protection against workplace violence. Are the facilities well lit? Is the parking lot well lit? Are the stairwells well lit? Are we back yet, Karim? Yes, we are back. Not yet.
60 seconds for people
Okay.
to leave their breakout rooms. So people will be coming back. They have a notification to rejoin the room.
Okay, so another thing that might be in violation here is the sanitation. I added on a feature, a kind of like a factoid that wasn't in the fact pattern, and that is that there is only one washroom for Carla and any other employees per floor, and it's all the way at the end of the floors. That might be a sanitation issue, especially if there are increased demands on getting washing your hands. And let's say the washroom never has enough soap, never has enough towels, and the water is cold. For whatever reason, the water just gets lukewarm. Those are all potential sanitation violations of the sanitation standard. And with respect to HAZCOM, let's say she's using a disinfectant bottle and there's no label on it. She has absolutely no idea what the chemical is. All she knows is it makes her kind of sick after she's used it for like 5 minutes. Maybe it burns her hands or burns her eyes a little. So that might also be a violation of that standard. All right, and 60 seconds.
All right, thanks for participating in that breakout group. We really appreciate everybody's energy and also the engagement. We really wanted to hear from you. You know, this activity was focused on how to incorporate some of the body mapping and hazard mapping tools into your kind of intake process. And so we want to have, and then how the law interacts with this fact pattern. So the first kind of report back from groups, and we'll just have like maybe 2 minutes, hopefully, or a minute to just want to offer for people to chat in the chat some of the questions that they would ask Carla to tease out whether or not the employer is in compliance with the various OSHA standards. So feel free to go ahead and chat those in the chat. We'll give people some time to do that.
We're gonna be reading the chat.
Yeah.
Okay, great.
So in the chat, I have whether there is an IIPP in place. Also have room 7 came up with what is the formal sick day policy? Were you made to take sick time after you stayed at home, after stay at home order? Were you informed of your rights to 80 additional sick hours under the FFCRA? Okay, and then any, the attendance policy feels like retaliation. Was any PPE provided to you? What is the policy for sanitizing between resident visits? Are you given extra time to wash your hands? Can a worker find out if there is an IIPP? These are all great questions. And then also wanted to ask and see if people could think about, it sounds like these are kind of also like you've applied the law to this fact pattern as well. So just give a few more moments for people to chime in about how in their group talked about how the law applied to this fact pattern. Okay, well, it seems like we're actually coming up short on time right now, but did want to just say appreciate everybody for encouraging employee to file complaints when OSHA is violated. Doesn't seem to meet minimum PPE requirements, issues with sanitation. Great. Concern of retaliation is violation of IIPP. Great. Okay, well, thanks everyone for sharing what their groups came up with. Again, these slides will be available, so if folks want to get more information about more specific kind of how the HAZCOM standard, IIPP, and the sanitation standard, kind of the interplay with that, hopefully we'll be able to see the slides. And now I'll pass it over to Karine to wrap us up.
Before we get to the questions, I would like to let you know that we will be returning to a webinar format next week. Thank you for engaging in this interactive meeting. We thought it would be helpful for you to be in groups, to think of questions and get feedback from each other on how to conduct a client intake. So you can see what kind of questions tease out facts that workers may not share initially. I will post the survey link below again. I also put it up a little more. The feedback link is for everybody to fill out. It's only required for people who are seeking MCLE. So we encourage all feedback for this interactive meeting. Our next one will be a webinar, and only if you are seeking MCLE it is required. Well, thank you, everybody.
Thanks, everyone. Bye.